Ja, unser nächstes Thema, meine Damen und Herren, Life Sciences. Österreichische Forscher und Biotech-Unternehmen befinden sich nach wie vor auch hier im internationalen Spitzenfeld. Etwa ein Drittel der Unternehmen entwickelt Antiinfektiva und Impfstoffe. Die Historie, auch das ist, glaube ich, weithin bekannt, kann sich sehen lassen von der industriellen Herstellung von Penicillin 1948 bis zum antiviralen Nasenspray heutzutage. Die FFG hat auch hier in den vergangenen 10 Jahren vielfältige Unterstützungsarbeit und Leistung vollbringen können. Das heißt aber nicht, dass es nicht auch hier noch Verbesserungsbedarf gibt, den gibt es ja bekanntlich immer. Noch immer ist es so, dass zahlreiche Ideen aus der akademischen Forschung oft ihren Weg in die Realität und vor allem auf den Markt nicht finden, und eine nach wie vor große Herausforderung ist natürlich hier auch das Finanzierungsthema, vor allem die Finanzierung junger Biotech-Unternehmen. Darüber wollen wir jetzt in der nächsten halben Stunde sprechen, und ich darf dazu herzlich auf die Bühne bitten Esther Notch, President and Chief Scientific Officer Arsanis Biosciences GmbH. Herzlich willkommen. Danke. Walter Schmidt, Geschäftsführung und Vorstand Afiris AG, ebenfalls herzlich willkommen. Und die beiden Vertreterinnen der FFG zu diesem Thema, die Leiterin des Thementeams Life Sciences von der FFG, Astrid Höberts, herzlich willkommen. Und als zusätzliche Unterstützung und Expertin der FFG, Birgit Tauber. Herzlich willkommen. Meine Damen und Herren, für dieses Panel haben wir uns etwas Besonderes vorgenommen. Wir haben gesagt, wir wollen das nicht nach dem üblichen Diskussionsmodus oder Ritus, wenn Sie so wollen, abwickeln, sondern wir wollen hier einen neuen Weg gehen. Wir wollen Ihnen 3 Thesen, wenn ich das so formulieren darf, an die Wand werfen. Die werden Sie dann gleich lesen können. Und wir hätten dann gerne auch Ihre Meinung zu diesen jeweiligen Thesen gehabt. Das heißt, wir werden hier im Saal dann auch so eine kleine Abstimmung, ein Voting machen, meine Damen und Herren, einfach durch Handzeichen, wenn Sie dann sagen, es sind ganz einfache Fragen, die mit Ja oder Nein zu beantworten sind, und ich werde Sie dann jeweils fragen, ob Sie mit Ja oder mit Nein stimmen, meine Damen und Herren. Due to the presence of panelists coming from countries, from different countries, we adhere to English as the language of shared communication. Mrs. Notch and Mr. Schmidt, let me ask you to introduce yourselves at first and to tell us what your companies, Arsanis and Afiris, stand for.
So Arsanis is a development stage biotechnology company founded 4 years ago. We are developing novel therapeutics to fight severe infectious disease. Our first product candidate targets staphylococcal infections in hospitals which are severe due to the antibiotic resistance problem or because of high mortality. The company is financed by a strong syndicate of 4 venture capital companies, 3 from the US, 1 from Europe, and also generously by FFG. So it allows us to run multiple programs and employ 30 people here in Vienna.
Mr. Schmidt?
Yeah, Afiris, I have to say, my favorite biotech company. So we are developing therapeutic vaccines against chronic diseases, so something which is typically not associated with vaccines. Typically people think vaccination is prophylactic against infectious diseases, so we are targeting chronic diseases with a therapeutic approach, so the disease has been diagnosed and then we try to help the patients by therapeutic vaccination. Indications we are working on are diabetes, Parkinson, Alzheimer's disease, and I would just state here that we believe that we are the world leaders in the treatment of Alzheimer and Parkinson. So we've just recently completed a phase 2 study in Alzheimer's disease showing something which is called disease modification. So the cognitive function of the patients have been stabilized in a causative way, because we also have stabilized the volume of the hippocampus, so this area of the brain where the cognition and memory is located. We have achieved something similar in Parkinson's disease in a phase 1 clinical trial, where we have stabilized the motoric and non-motoric functions of patients. And this stabilization was achieved in patients which have generated antibodies against the therapeutic target, which is called alpha-synuclein.
Mrs. Höberts, I've already mentioned it in my introduction. FFG has supported innovations in these fields during the last 10 years in many ways. May I ask you to tell us more about this empowerment? And second question, why are we focusing on vaccines and antibiotics today?
Yes, thank you very much and good afternoon. So why we have chosen the theme of antibiotics and vaccines, first of all, we, as you said, we fund a lot of companies active in this field in the national programs. And as you all know, infectious diseases are very relevant, and we see this nowadays with Ebola, for example. It's always very timely, and it's a high burden also on the healthcare systems, not only the infectious diseases, but also the multi-drug resistant bacteria, for example, in hospital. You've mentioned the theme has a long history in Austria. It started with the penicillin. We all know the FSME vaccine that's coming from Austria. And now we have a really successful high number of innovative companies active in this field, which we're also actively supporting through FFG. And not only nationally it is of high relevance, but also the theme is of high priority on the European research politics. So we also see, because I'm the national contact point, so I'm responsible for health researchers, advising them for Horizon 2020. And also in European programs, vaccines, antibiotics, there are always calls open for this. It's also very relevant.
So let's proceed now to our first thesis, to our first question. Can we see it? Yes. Österreich, Land der Ideen, ein Paradies für Startups im Bereich Antibiotika und Impfstoffe, Land of Ideas, a paradise for startups in the area of antibiotics and vaccines. Meine Damen und Herren, Frage an Sie. Wie würden Sie voten? Ja? Ja? Oder nein? Das ist die Gegenprobe. What will you say? The majority is no. Or? Okay, majority is no. Mr. Schmidt, what is your experience with funding in Austria? What are the advantages and disadvantages of Austria as a business location for young life science companies?
Well, I think the advantage is, or there are several advantages here. There are the soft facts, as you know, that Vienna is a city which is always high ranked for quality of life. This is something very important, and this support by public financing, FFG, but also CIT, Vienna, City of Vienna. So I think the supportive structure here is very helpful. So in particular in the beginning there's also the RVS seed financing program. So you can really, if you want to make up your business, if you really want to start here, this is the right environment to do this. Problems might be in particular for the biotech company, such that we need quite a substantial amount of money for getting to something which is called the proof of concept for technology for a certain product. And so there is a little bit of a certain gap between seed, start, supportive financing, and then becoming attractive for venture capital. And I always say for a couple of years now, regarding this point, that something which might be helpful and which I think sort of has been started at the RVS, it should be sort of what the Scandinavian guys do. They just have funds financed to 50% by the company, by the country, sorry, and 50% by the industry. So this seems something which can fill the gap between the very excellent, early financing and then becoming attractive for venture capital, for example, or private money. Another disadvantage that I see is a very general one, which is, discussed all over the place for decades, which is, I think, it's the tax system. Yeah? So we have to hire very qualified people, also from abroad, and they have to pay 50% of tax. I think this is something which really, we always see that. We just hired some Swiss guy coming from UK, so he was looking at his Lohnzettel and saying, so what's going on here, you know? I think this is something also regarding priorities, you know, I think money, and if they then have to tell what is the money spent for, you know, what are the priorities, and if they then find out that some 10% of the yearly budget of the Republic of Austria, which is roughly 80 billion, so 8 billion are spent for retired people from the civil service, which is a huge amount, and each of these guys is getting out 400,000 euros on average more than he paid in. So I think this is money which I would see could be relocated, reallocated, and used more efficiently for innovation, for education, all these things which are discussed all the time.
Okay, Mrs. Nautsch, compared to other countries, is founding of a startup in Austria easy or difficult? And what are the do's and don'ts of a business startup?
So I have an extremely good experience in Austria with a startup company, and I think it's unprecedented. And I discussed with my funding colleagues who are also founders in other companies in other countries, and they are really envious. And US VCs are also really surprised how much support a company can get from the governments. I think it's absolutely positive. I think partly I share Walter's concern about the next stage of support when you are already in the clinic. Although I believe that with a good financing plan and also with good investors and the generous FFG money, I think companies can be in the situation that they become attractive for further venture investment, which then helps them to develop their product in the clinic. In terms of do's and don'ts, I think what's really important is to have very firm foundations and from the beginning build a company on a strong investor basis, and also bring complementary expertise into the company, and also so to build a team which shares the vision, not only on the short run but also in the long run. I think what's also important, not to give up the vision for short-term benefits, and be humble about success, and be gentle with PR until you will prove that your technology and your ideas work.
Thank you very much, Mrs. Tauber. What support does Austria offer for startups, and how easy, or on the other hand, how difficult is it to get financial support and funding in Austria?
Generally, we should distinguish between the situation of public funding and private financing. You mentioned that already. Regarding the public funding, we heard from Esther, the feedback we receive is very positive compared to other countries. So we cover with the Austrian funding instruments the very early stage phases till the later stage clinical projects. And together with our sister organizations, AWS or FWF, and the regional funding bodies, we always try to offer the best funding portfolio for the applicants. In total, FFG spends around 50 million a year for life science projects, and from this amount, more than 50% go to small and medium-sized enterprises. So far, so good. Is this now the paradise? I would say we see the front door of the paradise, but there is still some way to go. And what we observed since the last years is two major obstacles. The first one is the financing. So in Austria, we have $10 risk capital per head. That's about 30% of the European average, and only 14% of the numbers in Switzerland. So there is much work to do to bring capital into Austria to support especially early stage life science companies. What we tried in FFG to close a little this gap is some funding schemes for life science companies with a rare disease program and with clinical trials program. there we spent till now 15 million euros the last 2 years, and we hope that with this amount of money we bring the young companies far enough that they are attractive for private investments, or even in some cases can go on the market independently. And the second obstacle on the way to paradise, what we observed, is this lack of courage of starting up a business. So we see hundreds of fabulous ideas in academia. For instance, the former genome research program resulted in more than 700 publications, 80 patents, but only 2 companies funded out of them. And what's the reason for that? So we are trying to optimize our funding programs for startups and incubators, but what we really need is people like you, so such role models that have been successful in building up a startup, make the public aware and learn from your success.
Okay, thank you very much. The result, the majority of our audience said no, Austria is not a paradise. Our panelists showed, I would say, a tendency to yes. Austrian biotech companies in this field are very successful and visible on the national and international level. Austrian public funding systems provide a continuous support, but one remaining challenge for the companies is still the financing of their later stage developments. Let's proceed to our second thesis. Zweite Frage, meine Damen und Herren, hier geht es um die Fachkräfte. Most wanted and highly in demand. There are no qualified personnel in Austria. Wer sagt ja? Das stimmt. There are no qualified personnel in Austria. Da traut sich jemand, ja? Und alle anderen sagen das Gegenteil? Okay, das ist doch, glaube ich, ein eindeutiges Ergebnis. Esther, in your opinion, can you confirm that the often cited shortage of skilled personnel is true in your field?
I would say yes and no. If you look for highly trained, academically trained scientists, technicians, scientists, then I think it's really easy to recruit very good people, not only from Austria but internationally. But when you look for senior director level or chief executive level expertise, I would say that's certainly difficult. And then probably Vienna is a very attractive city, I agree, but still I think mobility is not that great. And certainly what would help companies is to have a critical mass here. So the companies train the entrepreneurs and the experts, and when companies rise and fall or they are acquired, simply the trained, experienced people find other jobs in new biotech companies. I think it's that therefore the critical mass is extremely important.
Mm-hmm. So Walter, what would you say, what are the requirements to keep qualified personnel in Austria or to recruit people to Austria?
My experience is that there is no major problem. So I mean, we have never had problems to recruit the people that we want, that we needed, and also from Austria. I think 70% at least of our employees are Austrians. Maybe we work here a little bit in a special way. So we recruited almost all of our at least key personnel through our network. So we never needed to use a headhunter. They always show up and say, so can we do something for you? I said, sorry, no, not yet, maybe later, but so far we have been able to find the people that we need also for key positions relatively easily. Also in Austria, some of them abroad, but so my personal view is there's not too much that has to happen and has to be changed.
Mm-hmm. Astrid, what can FFG offer to support Austria's young academics for careers in research and to become fit for the market?
Yes, actually FFG very actively supports young academics, young scientists and careers in research in almost all stages, and there's a wide range of programs. I'm not going to go into details, it would take me a while to list them all, but we support pupils, we support internships and also at later stages. What I wanted to mention specifically are the new scheme, Industrienahe Dissertation, which was just started, and actually the first grants were just awarded. And we saw a very high interest in life science companies here. So of the 6 successful ones, I think 2 or 3 are actually for life science again. What you mentioned, Esther, the mobility, I can actually stress, I think it's so not FFG specific now, but when I also look at European programs fund mobility of postdocs, and what I've observed in Austria is also the tendency not to really go abroad. We live in Vienna, it's a very high quality of life, and people then tend to stay here. And I think this could increase the mobility of students to go abroad for a while, and then we have to work to get them back to Austria, either with Marie Curie grants, or if they're very experienced, also with an ERC starting grant from the European Commission, for example, to come back to Austria. And we are very lucky in Vienna. We have this incubator region, basically where you are both working at the Vienna Biocenter, started a long time ago with the IMP and Intercell. And I think both of you don't have too many difficulties because you actually work in this area and you recruit from within the scene there. So FFG just does support in different career stages and helps academics and students. Yeah.
Okay, so I would say there was a clear no in the audience and a clear yein. I don't know what is yein in English, ness maybe, amongst our panelists. Let's proceed to our next and last thesis. Question number 3. Austria qualifies for the European Biotech Champions League. Yes? No? Okay. So, Astrid, which attractive funding programs are offered by the European Commission to support biotech companies, and what services does FFG offer?
Yeah, I end and I start again here. So just to give you a few numbers, in FP7, the 7th framework program, the theme health has taken 100 million euros of funding back to Austria. So Austrian researchers recruited 100 million euros, and health continues to be very high on the agenda, also in Horizon 2020. It's the biggest challenge. It's got 7 billion euros of funding for the next 7 years. So that's for very classical projects with many partners, but you can tell us a bit more maybe about this later for collaborative projects. But what I wanted to mention is that there's also a very interesting new funding scheme. That's the Sme Instrument, which is for the first time the European Commission allows single companies to apply for funding. This is for high-risk, very innovative projects, and this is implemented in 3 phases. So first it's a feasibility assessment, and then it's a research and innovation project, and then at the end it's support for commercialization. I hope what FFG offers is well known here in the audience. The unit of European programs, we help you for free through all stages of your project applications. We check the ideas, we give trainings on different subjects. We check the proposals very thoroughly and give critical feedback. And what we've seen in FP7 is that projects that were in contact with us had a higher success rate compared to coordinators that were not in contact with us. And Austrian biotech companies, so to come back to the question, European Champions League, so concerning biotech and not football. So the biotech companies, I think they are successful, and we have 2 very successful examples here today. Arsanis, so Esther, they just got the Sme Instrument, so this new funding instrument, 1 out of 4 successful Austrian companies. And Afiris has, as a small company, coordinated big collaborative projects in FP7. These are two top examples, but in general I can say that for sure there's a potential to become better here. I think there's a lot of unused potential, and I think there's still a lot of hesitance to apply here, and also a lot of bias that this is all too complex and too bureaucratic. I want to stress that the European Commission has really put substantial effort now to make the procedures more simple, and it has an attractive funding rate of 100% funding, and this you can really not find anywhere on a national basis.
Esther, how easy or, once again, how difficult is it for a young SME to get established and to network successfully in the international market?
Yeah, of course, it's a very complex job to build a company and also establish the science and also develop a business plan which supports the team until proof of concept. I think, as we discussed, the first critical years are the first couple of years are the most critical, because that's where you can make wrong decisions because you need money, and then you just accept whatever investment and which may not support you in the future. So I think with the FFG support and the public non-dilutive support in Austria, you can be much more selective, and you can wait for the right moment to make this investment. And the second part of the question was?
The second part was about networking.
Networking, yeah. So this is a very international business, so it does not really matter where you are. So you have to interact with the world. And as Austria is becoming more and more visible as a biotech scene, I think it becomes easier. I would say we are not there yet, but all this investment and support, I think, in the next decade can bring a higher visibility and also a more critical mass, which can really support this biotech scene here.
Mm-hmm. Final question, Walter, concerning European framework programs such as Horizon 2020 and FP7. How can Austria's SMEs profit from the funding schemes, especially from the new innovation instruments?
Well, I have to say, during the last years, so these European opportunities of funding have improved very much. Yeah? So 10 years ago, you had to find 10 collaborators from 20 countries to get a project funded. So then this went down to, just a small number of participants. And now we have this situation where you can just go on your own and ask for funding. I think this is a very important improvement on the one hand. On the other hand, it seems that, the application procedure is getting more and more complicated. And I think the FFG has, realized that and really has specialized people now for helping companies like us, to get all this done. And we had the first Vorgespräch, and then I just learned, so this is really the way to go. And we realized very easily, because you have done the work before and analyzed the program and told us, that's the way you should apply. So these are the programs. These are, so we had, certain projects. So what do you think about it? And they say you should better go for this because of this and this reason, and stay away from another application because this has the most likelihood of success. And also, I think the mentality that we just experienced here is that the FFG really wants to move programs forward on the European level, which have the highest likelihood of success. So that was a very clear message, and I think this is a very important message and a very important attitude, and I very much appreciated that.
So, thank you very much. I would say in the end we had a coincidence between our audience and the panelists in this question. You both said yes with some reservations. Is that okay? Okay, thank you very much for your contributions. Danke Ihnen, meine Damen und Herren, dass Sie auch aktiv mitgemacht haben. Herzlichen Dank noch einmal Ihnen und wir machen jetzt eine Pause. Ich glaube, eine halbe Stunde, wir liegen gut in der Zeit, das heißt, wir können eine halbe Stunde Pause machen und treffen uns hier pünktlich wieder um halb, 10 nach halb, okay, um halb, schauen wir, dass wir um halb da sind. Bitte achten Sie einfach auf die entsprechenden Signale, dann geht es weiter mit dem nächsten Panel. Vielen herzlichen Dank. Bitte schön. Thank you.